Greetings. My name is Rohit Vichin and I'm a clinical psychologist working with NeuroGen Brain and Spine Institute. I specialize in treating children on the spectrum with intellectual deficiencies or any other neurodevelopmental disorders. So today I'm going to be talking about how to handle aggressive behavior with children on the spectrum. With my experience, I've seen that parents and caregivers generally face a lot of issue with aggressive behavior of their children on the spectrum. Now, aggressive behavior in children can be due to a lot of things. Major of them being one, because they cannot convey their needs or understand what we want them to do. Second, could be because of changes in routine or changes in their daily chores or daily routine or a change in place. And the third could be anything that they're not able to do or express. So understanding aggressive behavior and managing it can be done in 4 parts. The 4 parts are identification, understanding, management, and prevention. So the first part is identification. Now we have to identify what is causing the aggressive behavior. Is it a change in their routine or place? Is it a change in the activities that are being performed, or is it a change in their sleep schedule? Is it a change in their food? It could be any change, both internal and external. So when I say internal, it could also be that a child might be in pain and they're not able to express it, and also we're not able to understand, because of which it lashes out in a form of aggressive behavior. Once we identify the problem, it helps us to move on the rest of the 3 parts. Once we've identified the problem, understanding it is the second part. Let's say if a child is being made to do something that is too complex for him and he's not able to understand what is being asked for him, might lash out in an aggressive behavior. So what we do in a situation like this is we lower the difficulty of whatever it is that being performed, and we gradually increase the complexity rather than just giving it up on him. So it could be, in a very layman terms, you go from level 1 to level 5 and not skip levels 2 and 3. One other portion of understanding what the aggressive behavior could be can also be because of excessive of sensory stimuli. So a sensory stimuli is anything that activates or aggravates all 5 senses of our body. So if there is too much noise in the background, if there are very bright lights, or even if the t-shirt or the clothes that he's wearing or she's wearing is uncomfortable or itchy, might also lash out in an aggressive form. Once we've understood, the third part is managing it. How do you manage the aggressive behavior? First and foremost is the safety of the child. You take out anything that can be hurtful to the child, make him sit down or use a pillow or anything to curb the aggressive behavior. Next, rather than getting more aggressive on him, we have to take out all the sensory stimuli that are there near him. If, let's say, a child is getting aggravated because of a lot of sound, we have to try to minimize the sound. If that is not possible, take the child to a place where there is dampening of the sound that is taking place. Once we do that, he gets calm and then we can resume. But as I said before, we're not going to give him something that he was not able to do. Rather, we give the child something that they know for sure that they can do and achieve to boost their confidence. Once this happens, we gradually increase up the difficulties so that they're also in sync with us, and they also know that they can do these things. And even if it gets a little difficult, rather than letting him maneuver it on their own, we also provide some kind of help throughout. And the last part is prevention. So once we understand what is it that triggers the aggressive behavior in a child, for example, if it is loud noises or anything of that sort, we curb those noises around. We understand that this will trigger an aggressive response in the child. So to our extent, we minimize the extent of loud noises that are there around us. And one other thing that you can use to understand the behaviors is something that we call as an ABC tracking. A stands for antecedent, B stands for behavior, and C stands for consequence. So your antecedent is anything that happens before the aggressive behavior. For example, let's say the loud noises are something that triggers a child. So you understand that, okay, every time there is a loud noise, for example, vacuum cleaners or firecrackers, so you know that a child is going to get angry if it is continuous. So what we can do is, once we understand the trigger of it, we control the trigger, the behavior in itself gets controlled, and the consequences will be that he is much calmer and he is performing his duties, or he's performing his activities the way we want him to do it and the way we want to teach him things. So this ABC tracking will help us to understand and curb whatever kind of aggressive behavior and responses that are there in the child.